our speakers have joined. Today's meeting will be taking a presentation from two able personalities, Dr. Chidima Azike and Dr. Mo Igwe. So the fact that their topic is on securing the health of the nation, so that we look at exposing the subtle nature of hepatitis. We have to look at this vis-a-vis the saying that health is wealth, and therefore a healthy nation is actually a successful nation and a secure nation. So this aligns with our mission of advancing peace, security, and conflict transformation. Because if you want a secure nation, it has to be a healthy one. And we have to start with looking at our health. And so these are our able speakers put us through in this regard. We will also, after we take the presentation, there will be room for questions and answers. And then we'll look again at what we need to move forward. So if there's anything that someone wants to, and then if there are announcements, we'll do that. And then we'll also, after that, we'll close. So I think that the best thing we can do now is maybe we'll take just maybe a second, and each of us, as part of the opening, we say a prayer in our individual ways, and then we can start. Okay, may God guide our presentation and the meeting and our meeting for today. Thank you. I give it back to Nosa.
Okay, thank you very much, Prof. Thank you for that short welcome address. So since we have few people available now, can we just do a short roll call? And please let us also try to send to as much contact that we have, that the meeting has started, so that we can have people join in before the main presentation. The attendance right now is not very encouraging, and then as much as we can, those of us that are here, let us remind others and maybe put a message on our group so that people can be aware that it has really started. So I think aside from Dr. Esionsa, please just do a brief introduction since we are not much. Thank you.
Okay, good evening, women of color. My name is Esionsa Ifo. I'm a medical lab scientist working in Benin City, Nigeria, with the Federal Neuropsychiatric Hospital in Benin. Thank you.
Welcome, Doctor. Thank you for always being here.
Thank you, ma.
Rekia.
Is Rekia there?
Sorry, good evening, Prof. Good evening, everyone.
Good evening.
Sorry, I was finding it difficult to unmute myself.
Okay.
My name is Rekia Mohammed, and I work with the Federal Airports Authority of Nigeria. I'm an aviation security instructor and also a national inspector.
Welcome.
Thank you.
Wonderful, Ezra. I'm not sure I got it.
Okay, good evening all. I'm wonderful.
Oh, wonderful, Ezra. We can't hear you.
We can't hear you. Maybe when you are able to come on, you can just put it on the group chat. I mean, on the chat. I think we'll all see it there. Iris?
Yes, I'm here.
A brief introduction. Roll call.
Okay, for roll call,
Yeah.
Just a
we
brief
have,
introduction, yeah, I think we started that already. Just a brief introduction of yourself, and then we'll move to the next question.
okay, Iris Oriakono, a university lecturer of Rivers State University, Nigeria. I'm part of the leaders group of WCAPS. And in participation, we have Dr. Moore from Rivers State University too. We have Professor Rabia, who is our leader. We also have Dr. Precious Etino sir. She's also a member. Then we have Dr. Ene with us. We have Rookie and the host from WCAP. In total, I think we are 7. Thank you.
Thank you so much.
Thank you. Thank you. Okay. Should I go ahead and introduce the speakers? But they are not here. I don't know. We have Beatrice. Dr. Beatrice is
yes,
here.
I'm here.
Yes. Oh, yes. Okay. Okay. I've seen Dr. Chitima is also here. I have the citation of Dr. Beatrice Moore. Dr. Beatrice is a medical laboratory scientist and a lecturer in the Department of Medical Laboratory Science, Rivers State University, Port Harcourt. She has a good background in medical microbiology and later switched to hematology and blood transfusion science. She's a balanced scientist, having worked on bench for a good number of years and now in the classroom. She is happily married with beautiful children. And I believe with this citation, we are going to hear a very promising and a good presentation today. You're welcome, Dr. Betty Moore.
Thank you, dear Prof. Good evening, Prof.
Good evening.
Good evening, everybody.
Good evening.
I'm highly delighted to be in the midst of great minds. I'm honored to be counted, to give a lecture in this group. Thank you very much. So we'll be looking at the subtle nature of hepatitis. So talking about the subtle nature of hepatitis is indeed a killer disease unknown to a lot of people. So everybody is careful. I want to have sex with a guy and he's HIV negative, so everything is intact. Nobody thinks about hepatitis. So we'll be throwing a little light into this big inflammation that affects the liver, viral hepatitis. And looking at our slide here, we have the background. Viral hepatitis.
Sorry, Dr. Beatrice, do you want to share your slide? You can share.
I thought it's shared already because I sent it to, I thought the slide has been shared already to the host. And then they made it available to everyone.
Okay.
I've checked, I've not seen it. Maybe when I get hold of it, then I'll share it.
Okay, so Dr. Chidima, I don't know if you can help send it across to everyone or to the host who can now share. Because it will make it easier for everyone to understand.
Okay, I'm trying to do that. I'm surprised.
Okay.
Yeah.
Okay. Okay, so can I continue?
Yeah, yes, I think.
Okay, Prof, please, how many minutes or hours do I have for this presentation? So I'll be properly guided.
Usually for the two presenters, we give about 35 to like 40 minutes. So maybe you'll be taking maybe like 15 to 20 minutes.
Okay.
Yes. And then
very
quickly, the other speaker can take the.
Okay. So very quickly, we look at the background of viral hepatitis.
No, she will take I'll just use like 5 minutes to summarize.
Okay then. Okay.
All right. So like I had earlier said, viral hepatitis is an inflammation of the liver. It attacks the liver. The liver is the kidney of focus for the virus. Basically, we have 5 causative agents that are responsible for viral hepatitis, and we have the hepatitis A, B, C, D, and E. I'm very sure a lot of people are now aware of that. And we also have some other agents that can induce hepatitis, like the viruses, bacteria, toxins, and chemicals. Viral hepatitis is a global threat, as over 400 people are already infected, and most of these people who are infected are chronic carriers of hepatitis. And we have about 1.4 million deaths yearly. Now, Nigeria, our beautiful country, happens to be one of the countries with the highest burden of viral hepatitis, with a prevalence rate of 11% of hepatitis B and 2.2% of hepatitis C, respectively. It's also important for us to understand that hepatitis B is 100 times more infectious than HIV, which everyone dread, while hepatitis C is 10 times more infectious than HIV. Hepatitis A and E can be contracted through the fecal-oral route. So if someone has a contaminated finger, maybe you touch something that had been pre-contaminated with someone who already has the virus, you can get your fingers infected, and then if you eat food with those fingers, you'll be eating the virus, as it were. Or you're eating food from those who serve food who are hepatitis A or E positive. One can contract hepatitis A and E from such people. Hepatitis D on its own is not able to survive on its own, except it cohabits with hepatitis B. So if hepatitis D must be in existence, then hepatitis B must be available. So whoever has hepatitis D automatically has hepatitis D. No, sorry, whoever has hepatitis D automatically has hepatitis B, as it were. While the other hepatitis, the C, the B and D, will be looking very closely at the B and the D. Sorry, the B and the C. Now I have a diagram here that depicts the liver, the normal liver, its shape and how it should be. And then we have another picture that shows, an altered liver. So when the liver begins to degenerate, it gets to a state where we call it end-time liver damage, and that's the cirrhosis, when the liver has undergone several, damage. Now, what causes this damage? The liver is a very big organ, plays a lot of role in the body, and it has a way of regenerating itself each time something goes wrong. So each time someone who is exposed to hepatitis B or C or any of the viruses or any of the hepatitis, each time someone who is exposed to hepatitis tries to regenerate or to normalize the system, the liver tries to normalize the system. What the liver does is, rather than normalize the system, it begins to scar. It begins to form scar. And at that point, of course, it's not noticeable to the bearer, but the scar formation just keeps on going on. It can last for up to 20 years. And then at some point, it becomes so bad that the person is no longer able to carry out its normal liver function. And then the person may have a packed up liver at that point. We also have a fibrotic liver. When we talk about fibrotic liver here, we're talking about liver that has a lot of fibrous materials like the fibrinogen, and other materials these proteins are normally not supposed to be chaotic to the system. Under a normal system where we have everything working in in a proper way. But when the system becomes chaotic as a result of the presence of hepatitis, these proteins begin to gather. And when they gather, they become fibrotic. And at that point, the liver is no longer normal. The liver becomes heavy and shapeless, as it were, begins to house a lot of proteins. And at some point, the liver is no longer able to carry out its function. It tries to. At some point, it tries to. While it is still compensating, it's trying to carry out its function. But at some point, it becomes decompensated. And at that point, the liver is not able to do its work again. It can also degenerate to cancer. And once it gets to that point, definitely the liver is packed up and is not able to do its work. Very quickly, we'll look at the incubation period and the group at risk. The incubation period for hepatitis B and C, hepatitis B is about 120 days and C is about 45 days. Who are those at risk? Who are those that are susceptible to contracting hepatitis? Particularly those who undergo hemodialysis in centers where they have poor materials that have undergone that have been autoclaved, particularly in private settings where they manage a lot of things. So they may want to reuse some of their equipment, and those patients who undergo dialysis are at risk. We also have those who undergo blood transfusion, if not properly screened. Again, some centers do not do ELISA. They just do the rapid tests. And when they do rapid tests with kits that are not, specific and sensitive, then they may have a false negative result. And when such patients are transfused with patients' samples that are already positive, they become automatic carriers of hepatitis. We also have the intravenous and intranasal drug users. Of course, healthcare workers are also at high risk. A lot of them get exposed to needle stick injuries. And when it happens, a lot of them do not go for post-exposure prophylaxis. We also have babies born to hepatitis mothers. Prisoners are not left out. They have a lot of habits that predispose them to hepatitis. Then we also know those who use who do tattoo. They have equipment they use. Medicinal products at home, and then we want to use the general one, and then most of these people who clean nails, they have a particular one. They tell you, oh, we have cortico that we can use to clean your nail, and then they use it to clean your nail. And if you have a pierce, definitely if it has been used on someone who was positive. Again, we have a lot of these malams who carry, blades and all that to clean nails. There are also people who help to transmit hepatitis. Now, it will interest us to know that viral hepatitis, being subtle in nature, can be chronic. It can also be acute. Hepatitis B, hepatitis C. For hepatitis B, for those who are acute, do not progress to chronic. Those who are acute, they end up becoming, it just happens suddenly, and that's less than 6 months of contracting the virus. Of course, such persons are, because they are acute, and they become sick and they are treated as quick as possible. For the chronic carriers, and we have about 75 to 85% of hepatitis B chronic carriers. A lot of these people are normal people. They are asymptomatic. They do not show symptoms of hepatitis. They live their normal life. They go about their normal business, and they just continue to spread the virus, as it were, to the general public and those who have contact with their blood and samples. For hepatitis C can also be, acute and chronic. But a lot of times when we have more of chronic carriers of hepatitis C, you know, and a lot of such patients, again, are not aware they have hepatitis. What are the symptoms? How do people know that they are carrying hepatitis? Some of the symptoms here are abdominal pain, dark urine, fever, joint pain, loss of appetite, weakness, fatigue, and all that. Of course, yellowing of the eye and the skin. But we have very key indicators to show when someone has begun to develop liver scarring or cirrhosis. So we have ascites. When someone begins to show ascites, star-shaped vein pattern at the belly, on the belly, where you have the swollen stomach, jaundice, and then itching, bruising, and they are predisposed to bleeding and bruising. Okay, so hepatitis A seems to be lighter than others. Hepatitis A does not degenerate to, it does not progress to the chronic type, but ends at acute. So within a couple of months, let's say 2 months at most, the patients can either go into viral remission, they can self-resolve, or they go take treatment and all that, and then they get well. And don't forget that hepatitis A can easily be avoided, unlike the others, because if you have a very good hygienic habit, you're always washing your hands. When each time you touch door handles that may be pre-infected, or you go to the toilet and you come out, you have to wash your hand, then you can avoid hepatitis A as quick as you can. Okay, so the transmission of hepatitis C. Hepatitis C can be transmitted basically by being exposed to blood through percutaneous exposure. What do we mean by that big word? Just the piercing of the skin. Once the skin is pierced with a contaminated, sharp object, then somebody might contract hepatitis C from someone who already had it, who had pre-used that equipment, you know. So we talk about contaminated therapeutic injections, and then dental surgical equipment, injecting an intranasal drug using, and all that. Of course, we've talked about blood transfusion, transplantation from infectious donors. And then we also have births to mothers that are already infected, and sex with infected partners. You know, so a lot of people just go ahead and they test their partners. I recall when I was on the bench, some guys will come almost routinely they come with new babes, come check out if they have HIV. And the moment that beautiful baby is HIV negative, they just go ahead to have unprotected sex, unknown to them that this beautiful babe may have hepatitis, but that is not known to them, as hepatitis is still not as known as the other viruses like HIV. Okay, so about 30% of infected persons spontaneously clear the virus within 6 months of infection without any treatment. That's hepatitis C. While the remaining 70% will progress to chronic hepatitis C. And a lot of people who are chronic carriers are not aware. I recall I did something for a company, and you know, while I was giving when I was asked to give some medical advice, and a particular guy had hepatitis A and B, sorry, B and C, and the young man was just living well, and he said nothing was wrong with him. Said nothing do him, you know, and the company laid him off. And I'm very sure that he's still living very well now, because he can continue that way till about 20 years. But at that point, how will he know that he's truly gone down in his liver? That's when his liver has probably become cirrhosis, or has become cancerous or something. But at that point, the liver is almost packed up and nothing can be done at that particular point. Okay, so how do I know that I have hepatitis C? Is a good one. There's a company they call, or there's an NGO known as CHI, Clinton Health Foundation or something. So they did some help for Nigerians. They shared Nigeria into 4 geopolitical, in about 4 states like that were used to run hepatitis C at a very low cost. At some point when those people were coming to do their tests, a lot of them cried and they said, oh, they were doing this test for over 100,000 naira for hepatitis C viral load. Oh, all thanks to these people, because they brought it down to as low as 17,000 naira. So the first step is to walk into a health system, do the regular rapid diagnostic tests to check out for the antibody. A lot of people may be asking, what do you mean by antibody? Okay, let's start by knowing what an antigen is. An antigen is something that when it is induced into the body, is an infectious agent. It could be bacteria, it could be parasite, it could be anything that is not known to the body. And once the antigens are injected, like the presence of hepatitis C or B can be likened to the presence of an antigen, because it's something that is non-self, that is not part of the body. The moment a non-self like hepatitis C or B gets into the body is aroused. There are some proteins we call antigen presenting cells in the body, like the macrophages, the dendritic cells, the natural killer cells. These cells, what do? They get the body excited. What they do, they quickly go to that point where the antigens are and they hold them down, and they present these infectious materials to the lymphocytes. The lymphocytes are the cells that are responsible, they are white blood cells, but they are responsible for production of antibodies. Antibodies are not already produced in the body, waiting for antigens. No, they get produced at the time when the antigens have been halted down by these antigen presenting cells, like I earlier said. And the reason is because each time an antibody is produced, a produced antibody has to be correspondent, or has to be in correspondence with an antigen that has just gotten into the body. So antibodies are not already produced. But so because an antigen has gotten into the body, like hepatitis C, the body begins to produce lots of because an antigen has gotten into the body begins to produce antibodies. So the moment someone goes for hepatitis C test and it shows positive, it simply means that that person has begun to produce lots of antibodies, to show that this person has been exposed to hepatitis C antigen. Again, we have the viral load testing, which of course is the confirmatory test. It gives you a quick, like, we know that if we are going to be using the rapid test, then the viral particles have to really, really be very high in the blood sample. But a lot of time when the persons are newly exposed, the viral particles are still very low. So what happens is these the PCR test, which is the quantitative test that tells you how much of the viral particles the person has, and if the person is even positive at all. It just gives you a quick result within 2 weeks of being exposed to hepatitis C or B. Then the next thing to do is, if you go to a private place, definitely you're going to be treated, but you're going to be spending some good money. So we encourage people to go to a recognized system where we have these NGOs, where they have paid some money and they've made treatments very easy. I remember in those days when I was also helping out, the NGO had to reduce the amount of money from 1.something million to as low as 500,000 naira. It was really higher than that, but it came that low. So it became easy for people not to die from hepatitis. How is it treated? basically treatment is done by the gastroenterologists in the hospital. There are doctors who have been trained to handle hepatitis issues. Okay, so very quickly, we also look at how to prevent this from happening. That I had hepatitis C, and God helped me, it became resolved either by treatment or by viral remission, by being remitted. I can also be exposed again. So people are encouraged to be very careful. We have what we call primary prevention. Just keep away from anything that will expose you to, other materials that have been used by others, like the manicure tools, of course, the use of sharps and all that. And then we have the secondary prevention. People are encouraged to once in a while go for testing. You don't have to get sick. A lot of time people know that they are positive for hepatitis when they go for blood donation. Someone has just come to give blood to maybe his wife or a relation, and then they tell him, oh, sorry, you didn't pass the test, you failed the test, and they begin to ask why, and then it's hepatitis. A lot of them are not aware because they had never gone for hepatitis screening. So let's look very quickly at the transmission of hepatitis B. Hepatitis B, unlike C basically you get it from blood-to-blood exposure. For B, you get it through blood-to-blood exposure as well as other body fluids like the semen, contaminated semen and all that. So a lot of times people contract it by sharing needles, syringes, drug injection equipment. Not left out is babies that are born to positive mothers. How do we diagnose hepatitis B? There are three main ways we can diagnose hepatitis B. So the first is a blood test, which we're going to take time to look at. I don't know how many of us are aware that outside the regular hepatitis B test, outside the regular hepatitis B rapid test kit, which used to be 700 naira, it's just a very simple test, and then they tell you you're hepatitis B positive. There's an other set of tests that is called the markers or the panel, hepatitis B panel test. You have about 5 panels. You have the hepatitis B surface antigen, you have the surface antibody, the E antigen, the E antibody, and the CO. So all these have their indicators. They indicate a particular thing. It makes it easier for the doctor or the clinician to know if the person is at the chronic stage or active stage or what's happening. So we're going to be looking at this table. I don't know how many of us have the slide already. So for someone who is negative for all these markers I mentioned, such a person had never been exposed to hepatitis B, and such a person had also never had the vaccine. So for those who have had hepatitis B vaccine, they will definitely have the antibody. So someone will say, oh, why do I have antibody? Oh my God, does it mean I have the virus? No. So each time, during the period when the vaccine was given to the person, what was a vaccine? A vaccine is a product that has an attenuated amount of what it is trying to avoid. For instance, you have the hepatitis B virus now. So they look at the people who produce the vaccine, they use the viral material, but these viral materials are weakened. They are not totally killed. They are weakened, not killed, weakened enough to elicit immune response when taken in. And haven't been taken in, they arouse the system, or they arouse the immune system to produce corresponding antibody, going by what I had earlier explained to us. So when the surface antigen is showing negative and the antibody shows positive, it simply means this person is intact. This person is not exposed. As a matter of fact, this person has guarded herself or himself very well. This person has taken anti-vaccine. Then when we have the core, the hepatitis B core positive, it means this person has been exposed to hepatitis B. When you have the antibody positive, the antibody is positive and the hepatitis B core antibody is positive, this person has been exposed, whether or not the viral particles have cleared either by treatment or by self-remission. So that person has, that in the body. For those who have the surface antigen, the presence of the surface antigen tells the doctor that this person is in an acute state. Of course, when somebody is in an acute state, then you need to run away from that person. I remember when we used to do the viral load, some persons we have as low as 20 copies per mil, just 20 copies of the viral particles. That's a good one if you ask me. That person is not a threat to his or her contact. But for those who are having something like 10 million copies, you want to run away from that person because that person is highly infective and can cause a lot of issue to those who share equipment or tools with such a person. So when someone again is positive with the core, it means that the person is actually positive. And then the person is positive for the antigen. The person is in an acute state of the virus and should be quickly helped. How do we avoid these subtle killer viruses or diseases? Very easy. Vaccination can take care of hepatitis A, B, and E. But don't ask me much about A and E because I don't know so much about them, but I'm very sure that there are hospitals that will be handling such if we make inquiry. But for hepatitis B particularly, I'm very much sure that for those who have not had the vaccine, after the meeting, as quick as you can, go get tested. And the moment you're negative, go get the vaccine. The vaccine takes about 3 months, the first dose, the second dose, and the third. It doesn't cost much. A lot of health centers do that at a subscribed rate. Then for hepatitis A, if you have clean habits, the moment you go to the toilet, you have to wash your hands. That helps you. When you touch anything that is being touched by a lot of people, by the public, nobody tells you to wash your hands. Just keep washing your hands. Personally, I carry wipes a lot. People look at me and they say, oh, you're overdoing it. Yes, I may be overdoing it, but I'm also trying to keep myself and also save people around me. So if I know that my hands are bad, I pull out a wipe from my bag and then I clean my hands very well. I began to use what they call it now that we use for COVID prevention. We rub it in our hands. The sanitizer, I began to use sanitizer long before the emergence of COVID. I introduced it even into in my children's school. Somehow they began to use it long before the emergence of COVID. So you don't have water to wash your hands, get your sanitizer, rub into your hand, and if you have wipes to clean your hand, you're good to go. So the plea is for people to go sing it everywhere they go to, in their church, in their houses, because a lot of people, there are loved ones, there are friends, there's someone that is just close to you. The person is doing very well, and suddenly that person is no longer there. What's the issue? That person died from hepatitis B. Wow, but she was doing well, she was living well. What was the issue? She was a chronic carrier. She didn't know she had hepatitis. There are people very close to me, I don't want to remember it, but they died of hepatitis. We didn't know, we couldn't help. At the point when they found out that they had gone far, the liver had already packed up. The liver couldn't do anything anymore. So the plea is, let's go get tested and quickly go get our vaccine and not let this subtle killer disease begin to rise up because the prevalence rate is actually coming up gradually. We don't want it to become like a HIV. Okay, so I'm going to stop at this point so that we can take questions. And then first of all, so that Dr. Chidi can also do her wrap up. Thank you very much for listening.
Thank you so much, Dr. Betty. Thank you so much. Thank you. Over to you, Nosa, to introduce Dr. Chidima Azike for the wrap-up. Nosa, are you there?
Okay, yes, I am. Thank you so much, Dr. Igwe. I think this is really great. Iris, do you have the citation for Dr. Chidima? Can you read it now?
Thank you.
Okay, so maybe I just take, I guess Iris is not available. So Dr. Chidima is, sorry, please hold on, let me just get my hands on it. Dr. Chidima Azike is also a medical laboratory scientist, and she's a lecturer at the Department of Medical Laboratory Science at Rivers State University, Port Harcourt. And she's currently running her master's degree in biorisk management, which is also very key to the national security, especially when it comes to biological weapons. She's married and God has blessed her with beautiful children. And I'm sure we're going to hear more from her while she presents. Thank you. Dr. Chidima, you're welcome. Hello, Dr. Chidima, are you there?
Yeah.
Okay, please go ahead.
All right. Good evening, all. Hello, good evening, all.
Good evening, ma'am.
Hey, guys.
Good evening. Good evening, Dr. Chidima.
Have the envelope again.
All right. First of all, I want to thank Dr. Beatrice Moore for that wonderful presentation, despite the short notice. It has not been easy, but we thank God we're able to keep to the track of this wonderful group. So we've heard today about hepatitis. I know that some person will be wondering, why hepatitis? As one of our goals, our security is important to us, our health is important to us. So in the aspects of health, we've today decided to look at hepatitis. The reason is because most people feel that hepatitis, since it's preventable, since it's curable, is there really any need to worry about that? Yes, it is very, very important we worry about hepatitis because it destroys our liver tissue. It spreads from person to person. So don't say that you are free because you don't know who is by your side, whether the person is free or not. And when it gets to us, it also weakens an immune system. It can cause our liver to fail. It can also lead to liver cancer. And in rare cases, it can cause death. In addition to what Dr. Beatrice Moore has said about the hepatitis, different types, I want us also to go home with this information. Who is at risk of getting this hepatitis? You may be in a very safe environment, yes, but then we don't know how safe the place we travel all the time is. So if you travel to any area with poor sanitation, you are at risk. If you also receive a long-term kidney dialysis, any of our family member, any of our relatives that receive such is also at risk. If we work in the hospital, even our nursing homes, we are at risk. If we have poor nutrition, we are also at risk. The youth take so much alcohol and call it enjoyment, you are at risk. Do you live your life carelessly just without minding what you touch, where you go? If you have that bad habit of not being mindful of how clean our environment is, you're also at risk. So it is important that we do the following, just as Dr. Beatrice Moore has advised. One, if you don't know your hepatitis status today, don't think that it's only HIV that needs emergency. It is important. Try as much as possible after this presentation today to get tested, know your status, and take vaccine for hepatitis. It is very, very important. Then, let us continue to practice good personal hygiene by washing our hands thoroughly with soap and water. In the absence of that, we can always make use of our hand sanitizer. Hand sanitizer is not only for Ebola and the COVID. Hand sanitizer is something we should always have, or wipe, as she advised. Then, if we love enjoyment, we should also reduce enjoyment when it comes to alcoholic drink. It's not good. Everything should be moderation. With this, I want to thank you all for the opportunity to make this presentation today and for your being present in your numbers. Please, every information is very, very important. We don't know it all. Every day we learn and we keep learning. For any information you receive at any time, try to make use of it. Thank you and God bless you all. Hello.
Wow, thank you so much, Dr. Chidima. Thank you for that.
Hello.
Hello, can you hear me?
Thank you so much. Thank you, Dr. Chidima.
Thank you so much,
Yeah.
Dr. Chidima. Thank you so much for that short and insightful words. I think we just go straight to question and answer so that we have more, we'll be able to get more insight. This is really, really interesting and it's indeed an eye-opener. Maybe if you have questions, raise up your hand. Raise your hand so that we can keep it brief. Or if you've typed it in the question, in the chat, I think I'm saying one. Someone asked that's coming from, I think I have a couple of questions here. I don't know if anyone documented it. Iris, did you document the question? The first one I'm saying here, are there signs to look out for before medical investigation? That's coming from Wonderful Ezra. And then from Peace, who is it? Dr. Moore, are you getting the question, Dr. Chidima?
Yeah, I'm getting the question.
For a husband that has HCV positive, what can be done for the wife to stay free from the infection since there is no HCV vaccine? So I think Wonderful added to the question, are previous vaccines taken during childhood enough for adulthood? I think she meant can it sustain adult period? I think I should just stop there. Will you go ahead to answer those ones, then we keep others coming? Thank you. Or okay. Should I go ahead to?
No, don't go ahead. So I don't lose sight of it all.
Okay.
Yes. As we respond, you can also bring more questions. Okay, so lovely questions you've asked here. So the signs, of course, we know that some of these signs also are signs for other health issues, but so these signs may not be key pointers. So we have dark urine, of course, we know of yellowing of the skin and then the eyes too. But you don't want to get to the signs that will show you the liver scarring or the cirrhosis. Because at that point, when those signs where you have the star-shaped vein on the swollen belly, of course, is a gone story. Just last week, I was talking with a friend and she told me, she was just telling me, have you heard that so mama is no more? the mama used to sell in a facility I had once worked. And then I asked, why, what happened? She said she just suddenly came and then she had a swollen stomach. And I said, how? That she was making fun with her. She said, Mama, you gave belly. That the lady laughed and said, yes. So, and then I said, I probed some more. She said, oh, the lady, they just found out the lady had hepatitis C. I couldn't believe it because I was there doing hepatitis C for a good number of years. Would have even done it free for her. We didn't know. And then maybe she found out when the liver had really, really gone bad. Then her tummy became bloated. And of course, she passed on, So the moment you notice dark urine, joint pain, for me, I don't even want to ask anybody who already is informed now to wait for any sign. Every 3 months, go get your hepatitis C test done. Of course, you're not doing it in fear. You're not doing it because you're, are you sure I've not gotten it? No, but you're just doing it to keep yourself healthy. Then for a spouse whose spouse is positive for hepatitis C, the first thing to do is to ask that spouse to go for a viral load. It used to be 17K. I don't know how much it is now. So a lot of people will run away because when you tell them the price, they will say, God forbid, I don't get them, they'll walk away. But those who really know what it takes, the issues involved in it, they quickly go for it. Some of them even save up money to do it as quick as possible. So the first thing to do is get a viral load test. A viral load test for hepatitis C is both quantitative and qualitative. Quantitative in that it tells you that this person, qualitative in that it tells you that this person is hepatitis positive. Because if it is negative, then it means the kit that was used to do the preliminary test, the one I talked about that will show you if the person is antibody positive or not, was wrong. Because we have lots of test kits that are very cheap in the market, and lots of facilities go for those, kits. I forgot to mention to us that there's a regulatory body governed by WHO, CDC, and all that. So they make sure that the right kits are used. But these kits are quite expensive. And because they're expensive, a lot of facilities do not go for them. You tell somebody to go and do a test, a regular test. You tell somebody to do a regular test for, let's say, 10,000 naira, they will complain. They'll say, oh, I not good. Because they already know that a lot of facilities will do for 700, 1,000. So when you do the viral load test, you have the results qualitatively and you have it quantitatively, the number of particles. If the person has a very low viral particles, the spouse is not at risk. Just like what happens in HIV. For those who have less than 20 copies of the viral particles, they can go ahead and have unprotected sex. There's no issue. Nobody is getting the virus. But when the viral particles are high, I personally tell the patient, even before they hit the doctor's table, I tell them, please, a particular young boy, beautiful young, let me use the word beautiful, like beautiful young looking guy, he had over 10 million copies, and I just could not hold it. And I just called him into an office and I told him, I have to let you know this. Please don't take it to her. Don't get sick because I'm telling you this, but I have to tell you, if you have a girlfriend, stop having sex with her already. Just stop it, shut down from anything, sexual activities, so you don't get people, we don't have a lot of people coming down because somebody who is highly replicating is having unprotected sex. So if a spouse is virally unsuppressed, the particles are high, you just cut off from having sex with that person, or you do it by protection. Of course, one has to be very careful because we don't want to lose our parents. We don't want to lose both parents, and we don't want also to have children, suffer because of hepatitis. I don't know if there's any other question I didn't answer.
Yes, I guess you have answered it. So I go on to, I think there are two more questions. Okay, Emejuru is raising her hand. So I'll just take these two questions on the chat. And then
okay, so someone is asking a question here, how you treat a co-infection.
Yes, And before that, there is a question that asks about hepatitic steatosis and what the relationship between that steatosis is with hepatitis itself.
So I didn't get the question.
What is hepatitic steatosis? And what is the relationship between hepatitic steatosis and hepatitis?
I'm not getting that word well. Can it be typed out? Okay.
I think I'll just recopy what the person sent and then paste it. So it will be the latest chat.
Okay.
So then you can go ahead and answer the other question, the co-infection question.
It's
While
okay.
we have Emejuru, please, you can speak now so that she take the 3 questions together.
Okay, so for someone who has hepatitis B and C, one can be handled by the use of vaccine. So the first thing to do is, we don't encourage people to just go ahead and start taking vaccine. The first thing to do is go do your rapid test. And the moment the rapid test shows negative for B, even if the person has C, go ahead and take care of the B by taking vaccine. And the moment that person is vaccinated for B, the C is easy to handle. The reason is because for someone who, don't forget that when we talk about virus being in the system, the moment a viral particle gets into the system, the immune system is aroused. And the moment that happens, these viruses begin to degenerate the immune system. At the point when the immune system gets degenerated, the person becomes vulnerable. So for someone who is, for instance, positive to HIV, that person is vulnerable or susceptible to contracting hepatitis C the moment that opportunity comes, because of, the person's body is already, the immune system is down. So if there is a co-infection for B and C, the antiviral therapy, there's a way the doctors do it. They do it in such a way that the viral therapies can be synergized in such a way that as you're taking a particular antiviral therapy, is taking care of the both. Yeah. Okay. Dr. Chidi, are you there?
Emejuru, please, you can go ahead and ask your question now. Okay, I guess she has typed it, but if you still want to go ahead to ask, please go ahead.
Yes. Good evening, ma'am. Good evening, everybody. Good evening, our 2 doctors that presented. Hello.
Yes, we are with you. You can go ahead, please.
It's my network. It has been coming up and coming on. I'm so sorry. Yes, network.
Hello.
Good evening to our 2 doctors that presented. I really enjoyed the presentation.
Hello. Network
good
seems
evening.
to be worrying.
It's network. Hello, good evening.
Dr. Mar, can you hear her now?
Hello, good evening. Good evening, doctor.
Yes, let her go ahead.
Okay, go ahead, please.
Go ahead.
Hello.
Okay. Good evening, doctor. Thanks for the presentation. Sorry to admit. Okay, my question is this: positive for hepatitis C after doing the surface antigen test, like this strip test. So when she went to the clinic, they told her to go for PCR, but the doctor said something that with time that she can actually shed off the virus for a young child. For young children, they can shed off the virus. So I want to really know how true it is, how possible that's. Hello, good evening.
Hello.
Hello. Can you hear me now?
Hello.
Yes, I can hear you, ma'am. Hello.
Hello, Dr. Mar. Did you get the question?
Hello.
Dr. Beatrice, did you get the correct question? Okay. So Marjorie, let me read the question to her again. Let's hope she gets it. Hello, Dr. Morrow, can you hear her? Can you hear me? Dr. Chidima, if Dr. Morrow cannot hear, can you please answer the question? I'll take the question again. So she's asking if a young child that got the virus. Can you hear us now?
Talk is bad. Hello?
Yes.
Okay. So if
Hello?
we can hear you. Can you hear us, Dr. Morrow?
Yeah, network is really bad for my end.
Yes, I guess so. So I want to take the question again, please. Any one of you can pick.
Okay.
Marjorie asked if a young child that got a virus, that has the virus, has gone for the strip test, and I think what she wanted to really know is that the doctors suggested or said that the child can shed off the virus over time. So she wants to know how real that information is, and if that can really work.
Yeah, when I was making my presentation, I said about 30% of people who contract hepatitis C can have it remitted. So, but how do we know if that person falls under the 30%? As 70% become chronic. However, it's possible, but the possibility again has to be under check. So while they are waiting, they keep doing the viral load, because the viral load gives you a picture of what happens in the body, not the strip test. Like I said, the strip test is a good one. If you want to go a bit higher than the strip, then you go for ELISA. A lot of facilities do not use ELISA. So if ELISA is used, ELISA is somewhat specific, but specific and sensitive, but the gold standard is the viral load. The viral load gives you a full picture of what happens in the system. This person had been once positive. The moment that person has become virally remitted, it doesn't show positive any longer. The system is not able to see the viral particles any longer. It's no longer there. So that mother or parent can keep undergoing viral test for the little child.
Load check.
Okay, I guess there are no more questions, but I will want to plead with you, or maybe Dr. Chidima, to please help us give maybe briefly, like a more specific roadmap to getting tested, getting prevention, maybe something just so that it will be like a more handy thing to take home. For example,
Okay.
your advice, you said we should all go get tested. If I'm living in Abuja, if I'm living in Lagos, if I'm living in Port Harcourt, if you have a few of those information that you can share with us, okay, go to this clinic that you are aware of. And if not, if you don't have a handful information, now you can also still share with us on the WhatsApp group, if that can be done briefly.
Okay, maybe if Chidi will have something to add to it, she can when I'm done. But I know that when I was involved, when I was really involved, we used to have trainings and all that we used to meet. But I've lost sight of all that now. But I know that for those who are here in Rivers State and those who are in South, it's not only for Rivers people. For those who are in South, like I said, Chai has given that privilege to those in South Rivers State, BMSH or Rivers State University Teaching Hospital. So they have flooded the system with the antiviral therapy, as well as I know they also assisted the laboratory by getting the first reagent, and then they put a mark. Don't go beyond this. This is what you charge. So the first thing to do is, like I said, get fear out of, don't bring in fear. Fear kills more than the disease. So don't let fear come in. We're not preaching the virus as it were, but we're just asking people to just get know about this so that you're not taken unaware. So the first thing to do is walk into any government system you have around you there, wherever you are in the north, south, east, wherever. Just let them know that you want to do hepatitis screening test. Then if you do it just for the purpose of clarity and quality control, you can get into another facility because you don't know the kind of reagents or rapid diagnostic kits they use. Because you want to be sure that the results is reproducible, you can go into another facility, spend a little more money from your pocket, repeat the rapid test. If the rapid test tells you that you are hepatitis C negative, good story. If it tells you that you're hepatitis B negative, sweet story. Yeah, but for B, once you are hepatitis B negative, you don't even want to talk about hepatitis B any longer. Just quickly run into a health center and then begin to take the vaccine. Get into the vaccine after 3 months. I know I had to, my then director, she was quite dogged about it. She took it upon herself. She spent so much money from her pocket, got everybody, made it compulsory for everybody to undergo the screening. And then she made sure everybody took the vaccine. And then after we took the vaccine, they gave us, I think it was life, I'm trying to get that word. Was it life dosage? I can't remember, but they give you something to seal it. So when you take that, you don't have to take it again, you know. So that's the very first step. Then the other one is for someone who has contracted the virus, it is not a death sentence. Fear shouldn't come in. Hepatitis B is treatable. Maybe I didn't mention that. If I didn't, I'm very sorry. Hepatitis B is treatable. All you need to do is you have done it, the rapid test has shown you positive, then enroll in the forgotten the name of this clinic now, where you have the gastroenterologist, but the system, the health facility already has an organized system of, oh, this person is hepatitis positive. They just send you to that clinic. I've forgotten the name of the clinic now. So when you go there, you interface with the doctor. The doctor tells you to go and do a viral load. He or she is handicapped until the viral load results comes up. When the viral load result comes up, three things are noticed. It is either the person has a very escalated viral load result, moderate, or very low. If it is very low, some doctors will not treat. That's where the little baby's case came in. You know, so when it is very low, oh, this baby, it will go into remission. Let's allow the body to clear it. They give some preliminary drugs, you know, not antiviral drug. And they say, come back after 3 months or so and go back again and redo the viral load, you know. Then for those who have high viral particles, I don't think a normal doctor will tell you it will remit, because that person is already showing that the liver is already highly tasking. The liver is undergoing a lot of, you know, issues, a lot of weight because of these viral particles. So the doctors put them immediately on antiviral therapy just to make sure that they become virally suppressed. And then finally, by God's grace, they may remit at that point when they have been suppressed. So basically that's it. Then for A and E, yeah? Basically, good hygiene. Good hygiene. Children should be taught, because I keep telling people some persons have very poor habits in toilet usage. You know, so some persons just go into the toilet and they mess up the toilet. Sometimes they just clean. If someone has messed up the toilet, it's not the person's fault. Maybe the person is having a running stomach and the person uses tissue to just clean peripherally. the particles, the viral particles just remain there. They remain there for a couple of weeks. You know, so when someone just comes in, opens the door, at the moment you touch the door, you have picked it already. Then you begin to touch the fecal oral route, that's the mouth. The moment a contaminated finger gets into the mouth, you have injected the virus unknown to you into your mouth, or it gets into your food or into your water. And that's why we also have to be careful when we go out to eat. You know, some persons are very good in, they look forward to eating when they go for functions like wedding and all that. Sometimes when you stay at the back and you see what happens where they share food, you don't want to even eat a well-looking food. A lot of rubbish happen behind. So if you can even get yourself properly filled at home and you go for a function, you don't want to eat. But if you have to eat, then you look at the environment. The environment is very critical. A lot of people who share food lick their fingers. As they are sharing food, they have particles of food on their fingers, they leak. And once I see it, it puts me off.
Thank you so much, Doctor.
It is well.
A lot of information and very interesting. But yeah, but because of time limit and we'll have to stop here. We hope to actually invite you for more of this. It's quite a lot of information to take in. I'm just trying to process them. I'm happy we have the slides and we'll go through them. Hello, can you hear me?
Yes, I can hear you.
Yeah, I said we would now look at the slides, and then more questions we'll be able to send to you and ask for more clearance. But you've done a very good job, and I want to thank you on behalf of WCAPS Nigeria, and thank Dr. Chidima Aziki as well, and your group, entire group, for putting up this presentation. At this stage, I want to ask if there's anyone who has AOB, anything, any other business, if you have something to say. Otherwise, in the absence of anything else, we'll try and close for this month, and hopefully we'll meet again next month for another topic, and expect I think group 3, or is it the group that would be presenting? Do we have any? Yes, okay. Go ahead, please.
Prof, I want to say something.
Okay,
I want to use this opportunity to encourage group members. You know, you don't know, we learn all the time. When you are called to do something, even if you have so tight schedule that you cannot, at least encourage the person who has found it's so funny, and you are called, you are shouted up and said, see, we have responsibility to handle, and you don't even show any concern. It didn't make sense. For those in group 3, please, if you are called, respond. Response is a way of encouraging one another.
Yes. And thank you.
And I also want to ask our executives to please see what we can do about this group, or reschedule it, please. Thank you.
Okay, thank you so much, Doctor. Thank you so much. Nosa, I think you've taken notes of some of these things. We'll discuss them, and we'll try and see how we'll resolve. In fact, we had resolved to meet with group 3. We'll try and maybe fix a time when we'll just meet with the group 3 on the next presentation. And
sorry, please,
because
I don't know what she meant by reschedule it.
Okay, please, okay.
No, we are not. What I'm saying is, maybe if there is 1 or 2, let us confirm that people who are in group are actually active. We need some persons, when you even check them, they say, what are you talking about? Some person join group without getting involved.
Okay. But I think the person who leads a group, we agreed that the person who is leading the group will bring all the group members together bring them up to date, and then let them all be on the same page. Probably like schedule a smaller WhatsApp group.
Okay, ma.
Yes, and then they can meet and discuss. That way it will ease some of the, maybe send them, if they are not on the WhatsApp frequently, the text message can be sent to their phone numbers so that they will now know if we fix, we'll do it in that way. Yeah, that's one other way of bringing people together. Yes, yes, thank you so much. And thank you all of you for your commitment. This one has been a very wonderful session. For me, I learned a lot. And I'm sure I speak for all those who are present here. And people who will listen to the recordings once we get it fixed and placed on the YouTube, it's going to go beyond here. A lot of people will learn. This is good, great information. And our health is very important if we want to do something and succeed and benefit the community. We have to be healthy, otherwise there's just no way we can do anything.
Yes.
So Nosa, in the absence of any other, we'll close. We'll close for this. We'll close the meeting.